top things dentists might not tell you, but can see in your mouth. Let's dig deeper at this topic. I'm Dr. Olga Dolghier, board-certified pediatric dentist and laser dentist here at Palm Valley Pediatric Dentistry. When you go to a dentist, sometimes people are embarrassed. They don't want for me to know that they have some type of problem, and they lie. Believe it or not, they do. Don't lie to your doctor, because by looking at your mouth, I can detect and tell you what you do and you don't do. Number one, if you do not floss and you're telling me that you're flossing every single day of your life, I can tell you don't. How do I know? If I floss your teeth, if my assistant floss your teeth, or we probe your gums and they're bleeding, it tells us that most likely you do not use floss at all, because your gums are weak, they're inflamed, the bacteria kind of growing around the gum line, create inflammation, and by just simple flossing we can prevent that, and we can tell if you do flossing or not. Second one, if you brush your best before your dental appointment, but usually you don't brush your teeth, I can tell that too. Couple of things, you might have old plaque build up in the back teeth, you might have to have a lot of tartar build up on your bottom teeth. Those things you don't see as a person when you do your brushing, but I, by using my magnification and other tools, can tell you that you don't brush your teeth systemically. And you might have a lot of cavities because of that. Another tricky one, if you tell me you drink water only all day long, just water, maybe milk here and there, just water, nothing else, by looking at your mouth, I can tell. Kids, adults, teens, if you're drinking a lot of juice or soda, your teeth might have enamel erosion. They're gonna look shiny. They look unusually flat and clean. That's because of the frequent consumption of those drinks with high acidity. Acid is very damaging for enamel. It literally washes off calcium ions from enamel, from the top surface of your teeth. And just by looking, you can see the glossy appearance of your teeth. And I can tell that you are drinking soda or juice. I might not see a difference, but I tell you what, there is one drink I definitely can tell you're drinking, and that's Mountain Dew. One of the worst soft drinks you can drink is that one. Why? Because it has extremely high concentration of sugar and extremely high concentration of acid and other additives, which are actually prohibited from use in different countries except the United States, and we call it meth mouth. Meth mouth is actually mouth of a drug abuser. By drinking Mountain Dew, the kids, usually it's teens or young adults, we cannot tell a difference, are you drinking Mountain Dew or you using meth? So when I was in dental school many years ago, I was in Louisville, Kentucky, we had a lot of patients who were on Mountain Dew systemically. A lot of them are actually construction workers. For whatever reason, they love Mountain Dew, and they would have cavity in every single tooth. And we call it Mountain Dew mouth. It looks the same as a drug abuser mouth, meth mouth. So we can actually tell you that you are on that particular soft drink. So stay away from those soft drinks. They have no nutritional value. They taste good, some of them to you maybe, but they don't do anything good for your body, for your teeth, nothing. So stay away from them. Just stick with water. Good water is always better than any other drinks. Also, don't forget, sometimes we get a teen in my office and all of a sudden I see the signs of dark stain on it is unusual, pyrethroid and smell and everything else, and I can tell you smoking. If you are smoking, your dentist can tell. The teen or young adult smokes, and we can tell by just looking at the mouth. Smoking, as you know, is terrible for you, cause cancer, oral cancer as well as lung cancer, and has other problems. So gums become very inflamed, and a lot of times kids have, or teens have gum recessions if they smoke, and they have a lot of gum inflammation because when you smoke, actually the little periphery arteries on the gum tissue constrict, and the gums literally shrink down from your teeth. So stay away from smoking, we can tell. also for my young girls. This is very tender, kind of very touchy conversation. But if you are making yourself vomiting, bulimia, we see it frequently in young girls and guys. Not as much guys, usually it's a teen girl. So by just looking in the mouth, we can see sign of acid erosion. Usually it's a full front teeth from the back side, and just by looking at that, we can tell that you might be vomiting. Bulimia is a serious condition, so it has to be treated because you're losing a lot of nutrients from your body. So it's a good conversation if you do that with your dentist and maybe addressing that with your primary care physician, because that can lead you to other negative diseases with body composition. So we can tell if you do that, okay? What else we can tell? I also can see if your child is a mouth breather. A lot of kids who are chronically congested, they cannot breathe through their nose. The skeletal change is happening. The mouth becomes more kind of high palate, and the face becomes narrow. They tend to have tongue forward, so they have, we call it adenoid face. Adenoid face is a traditional name for facial features of a child who cannot breathe through the nose. So the elongation of face, dark circles under eyes, also open mouth, posture of the tongue, those are signs of mouth breathers. Also, they tend to have a lot of cavities, because when you mouth breathing, your mouth becomes dry, and as a result, you don't have enough saliva flow and you can get more cavities. So those are multiple signs which we can tell by just looking at your mouth. So if you like this topic, share with me, tell me what type of things you do and you might not want your dentist to know, or you want to share if you feel comfortable. And thank you so much for watching, and I'll see you next time.